So we're with Dr. Leana Wen, Health Commissioner for the City of Baltimore. Dr. Wen, you talked about how a patient of yours slipped into addiction after a sports injury. How common is that, and how has that influenced your thinking about what to do as Health Commissioner?
Statistics show that 80% of individuals who use heroin first started by using prescription opioids. We know that there is an epidemic of overprescribing of opioids happening. There is more than one bottle of opioids for every adult American every year. And understanding that this is what's happened has made me change my own medical practice, but also guided what we're doing here in the city. We know that doctors are well-meaning, that doctors want to do the right thing for our patients, and so we have to provide the right tools, the education for doctors, but also we need to make sure that doctors then can connect our patients immediately into treatment, because it's not enough to just save someone's life. Although that's important, we have to get naloxone into everyone's hands, but we also have to get people into treatment at the time that they need it.
Okay. So as far as getting naloxone into everybody's hands, you as Baltimore City Health Commissioner wrote a script for 650,000 people, is that right? And tell me why you did that and how has that worked?
Naloxone is safe, it's effective, it's easy to use, and there are very few antidotes in the world. Naloxone is a complete antidote to opioids, and we believe that it should be in every single person's hand. If it's true, and it is, that addiction does not discriminate, that addiction is a disease, that addiction can affect anyone and everyone, then everyone should have naloxone in their first aid kit and in their medicine cabinet. And so I issued a blanket prescription to every resident in the city so that we can all save a life.
Okay. And what has been the uptake on that? How many of those scripts have actually been filled?
In 2015, we trained over 8,000 of our residents on how to use it. And we've even trained our police officers, and within the first 6 months of the training, the police have used naloxone to save the lives of 21 of our citizens. We've had hundreds of other people using it in other ways, and so we're also training people where they are. We don't just expect them to come to us at our clinics. We have our needle exchange vans at over 20 locations in our city, where we train people on the streets, we train people in markets and public housing, and we want to bring this life-saving medication into the hands of everyone. And we've also started a 24/7 phone hotline that then people can call to get referrals for appointments. They can then also get assistance immediately from a counselor, social worker, or an addiction specialist.
Okay, so are those part of the three pillars that you talked about? What are the three pillars?
3 pillars in Baltimore City, because we believe that we are turning our city into a model for addiction recovery. First is saving a life. If we don't save someone's life today, there's no chance for a better tomorrow, so we have to get naloxone into everyone's hands. Second is ensuring access to high-quality, on-demand treatment. What works is medications combined with psychosocial treatment, combined with wraparound services. And we need to get this evidence-based treatment for everyone, including the 24/7 hotline, but also offering individuals treatment instead of incarceration, which we just started a pilot program for. The third pillar is fighting stigma with science. Educating our patients and the public. We started a campaign called don'tdie.org, and also we're educating physicians about the necessity of co-prescribing naloxone, the dangers of benzodiazepines and opioid medications together, and to be careful about prescribing these very addictive substances to our patients.
Okay, and finally, do you still face resistance to treating this not as a crime issue but as a health issue?
I'm glad that we heard President Obama, we've heard the Surgeon General, we've heard many of our officials around the country speak about addiction as a public health issue and not as a crime. We know that treating addiction like a crime is inhumane, it's ineffective, and it's unscientific. And this is a conversation that is changing. We're seeing a sea change, actually, of attitude. But what we need is not only the acknowledgement that addiction is a disease. We need to have our policies change accordingly so that we have to get people into treatment instead of jail. We have to give people their lives back instead of a life sentence. And we have to increase funding for what we know to be effective treatments and evidence-based treatments.
Okay, that's all we need. Thank you very much.
Great, thank you. Thank you for doing this.
Oh, sure.